that.
Yeah, in Sri Lanka, senior lecturer means assistant professor.
Yeah, similar to that position. Okay,
Yes.
thank you, Dr. Oni. I'm going to share the little thoughts with you how cultivating happiness and resilience mind in transform diabetes care when we bridging the modern neurology and endocrinology with the timeless wisdom of Ayurveda. Go to the next slide. Today, my presentation is briefly going on under the topics of diabetes beyond metabolism, concepts of resilience mind, neurobiology of resilience, some practical strategies based on Ayurveda perspective and the integrative pathways, and evidence-based, some evidences and some references for your more information and future directions only. Can you please share the full content of the slides from next slide? Okay, like this, complete slide. Next slide, please.
Next slide.
Next.
Okay, ma'am. Introductions.
Yeah, okay, come into the introduction. Okay, right. Yeah, diabetes is not only glycemic, diabetes is not only about glucose metabolism, as Dr. Natasha said, but she also mentioned everything. It's also psychosocial challenge. Like stress, anxiety, and depression worsen glycemic control. On the other hand, happiness and resilient mind can control diabetes and they can adhere to the treatments and sustain lifestyle changes. This is why diabetes care must address both the mind and the body together. Go to the next slide. Yeah, what is diabetes distress? The emotional strain of living with diabetes is distinct from clinical depression and affects to 45% of patients. It correlates with poor glycemic control, reduced self-care, and increased complications. Depression and anxiety are more prevalent in people with diabetes than in the general population. These conditions impair motivation, executive functions, and adherence to treatment plans. Stress activates the hypothalamic pituitary adrenal axis, increasing cortisol levels, which antagonist insulin and raise blood sugar. Chronic stress also promotes inflammation and insulin resistance. Next slide. Yeah, when stressed, we know the body releases cortisol and adrenaline, which increase blood glucose to provide quick energy for perceived threats like fight or flight mode. We know need increased metabolism and increased blood sugar for that fighting and flight. So next slide, please. Depending on how stress alters eating and medication habits, stress can cause hyperglycemia, sometimes hypoglycemia. And next slide. It's somewhat not comfortable for me to go in like this. Yeah, next slide, please. Yeah, stress often leads to unhealthy coping behaviors like overacting, skipping exercise, poor sleep, neglecting medications, etc. Next slide. Yeah, stress is closely tied to depression and anxiety, which can reduce motivation to self-care and worsen diabetes outcomes. Yeah, next slide. I'm not going to tell many things, so you can just pass the slides. Yeah, managing diabetes itself can stressful. That means increased stress, worsen blood sugar. On the other hand, unstable blood sugar increases stress. That's going like circle. Next slide. Yeah, persistent stress can also contribute to insulin resistance, making diabetes harder to control. It increases the risk of complications such as cardiovascular disease, neuropathy, and kidney problems. Emotional burnout from stress can reduce adherence to treatment plans, leading to poor long-term outcomes. Yeah, next. What is resilient? Resilient means the ability to adapt positively to adversity. Happiness acts as a protective factor against stress. In diabetes care, resilient mind foster motivation, discipline, and hope, qualities that directly influence treatment success. Next slide. Resilience is neurobiological. The prefrontal cortex regulates stress and decision making. The amygdala detects threats, while the hippocampus supports memory and learning. Neurotransmitters such as serotonin, dopamine, and GABA shape mood, motivation, and calmness. Importantly, neuroplasticity allows the brain to adapt and rewire even under chronic illnesses. Next slide. Yeah, the nature given us four gift packs. Those are the oxytocin, serotonin, dopamine, and endorphin. We know that oxytocin that we introduce as love hormone. When we are loving and compassionate with others, oxytocin already secretes from our brain. And endorphin, that is the natural painkiller which already we have. We can increase our endorphin without any medicines, with laughing, exercising, watching comedies, etc. activities. And serotonin, that is our mood stabilizer from nature. Yeah, when meditating, running, like activities, swimming, like kind of activities, we can increase our serotonin levels. And dopamine. Nowadays, all are talking about the dopamine, how we can secrete our natural and good dopamine. Just we can complete our works, we can complete our task, then dopamine will reward us. That is the natural reward. So we can earn something and we can give rewards from ourselves to us. Yeah, I'll go to next slide. So Ayurveda teaches that the mind and body are inseparable. Mental balance arises from sattva, while vitality and resilience are sustained by ojas. Disturbance in rajas and tamas weaken coping ability. Ayurveda therefore emphasizes cultivating clarity, calmness, and vitality for resilience. Next slide. Yeah, in Sri Lankan tradition, made rasayana herbs such as brahmi, ashwagandha, and mandukaparni are used to enhance cognition, reduce stress, and promote resilience. These formulations strengthen both mind and body, supporting patients with chronic illnesses. Next. Neurobiology, endocrinology, and Ayurveda converge on shared mechanisms: stress reduction, neurotransmitter balance, and improved metabolism. Together, they form a holistic model of care that address both psychological and physiological dimensions. Go to next slide. Yeah. Clinical studies have shown that yoga, meditation, and rasayana therapies can improve HbA1c levels, reduce stress scores, and modulate neuroendocrine markers. These findings validate the integrative approach and highlight the importance of resilience in diabetes care. Go to the next slide. Dietary guidance stabilizes glucose levels and supports metabolic balances. Meditation reduces stress, modulates neurohumoral mechanisms, and enhance emotional resilience. Rasayana therapy, Ayurveda rejuvenation therapy, contributes to long vitality, psychological stability, and improved glycemic control. Together, these interventions demonstrate how integrative care blends biomedical and traditional approach, yielding both clinical improvements and psychological benefits. Go to the next slide. Practical strategies include a balanced diet, regulate exercise, adequate sleep, meditation, pranayama, rasayana supports. These interventions are simple, accessible, and effective in strengthening resilience and happiness. Next. Yeah, relaxation techniques, meditation, yoga, and deep breathing lower cortisol levels as well as increase serotonin and endorphin. You can learn many yoga postures for control and manage diabetic mellitus. Next slide. Yeah, regular exercise reduces stress and improves insulin sensitivity, increase serotonin and endorphin. Active blood moves fast, and resting inactivity, blood moves slow. So exercise makes insulin stronger and long-lasting and longer. Next slide. Yeah, structured routines. That means our daily routine habit should be every day same structured manner. Yeah, consistent sleep, meal, and medication schedule stabilize glucose. Ayurveda dinacharya increase serotonin and endorphin. We can increase dopamine when we completing the daily routines every day. Finally, at the end, we can be happy. And also, when we self-caring, that means when we doing abhyanga, that's when we doing abhyanga, we are loving to ourselves also. No? So self-caring and abhyanga and so many things we can enhance secretion of oxytocin too. Next slide. Support systems, talking with family, friends, and professionals help manage emotional load, increase oxytocin. Next slide. Counseling or diabetes education programs can also provide coping tools. Go to the next slide. In Sri Lanka, there are a lot of spiritual therapies generally using, like doing worshipping Lord Buddha and worshipping Bodhi. So many things we can use these things also as spiritual therapy. Next slide. Yeah, these are the references. You can get more information. Next. So future research must focus on rigorous trials, interdisciplinary collaboration, and elevating Ayurveda to global recognition. By integrating ancient wisdom with modern science, we can redefine diabetes care. Next. In conclusion, resilience and happy minds are not luxurious but necessities in diabetes care. Neurobiology explains the mechanisms and endocrinology shows consequences, and Ayurveda offers timeless strategies. Together, they empower patients to live healthier, more fulfilled life. Next. Yeah, my heartfelt acknowledgement to Dr. Munira Ahmed and Dr. Tanveer Ahmed. Without you, I will not share my ideas and my thoughts. And also, I like to acknowledge our V5 group, Dr. Natasha, Dr. Neelam, and Dr. Nadi. I want to remember them also. And thank you very much for all the participants. And thank you all. Bye-bye.
A big hand for